My name is Dr. Katie Lee, and I am the CEO and founder of Collective Health Society. I got into this functional and biological dental practice because I started noticing that a lot of my patients who had several different systemic diseases also had chronic oral disease. And so I created this center where patients can come in, get different testing, and get different holistic and functional services. That way we can work together collaboratively between healthcare providers and help improve patients' health. Saliva testing is critical for patients' health because unless we know what is present in someone's saliva, we don't actually know how to treat them and make them better. In fact, half of the pathogens in the mouth are actually resistant to cleaning alone, which is why people are constantly plagued with bleeding gums and actually never see improvement. So if we test the saliva, we know what bacteria is there, and then we know how to tailor treatment to make patients the healthiest we can. When patients go into their routine dental checkup and cleaning, which is typically every 6 months, they'll experience a regular teeth cleaning. They'll get their teeth polished and flossed, and that is about it. And what we know is that over time, patients really don't see that much of a benefit from those types of cleanings. In our office, patients come in and they will have 2 different types of saliva testing. And based on those results, we will tailor the type of cleaning that the patient receives. We'll also use adjunctive therapies such as ozone, laser, supplements, and other herbal remedies to really treat their oral microbiome, reduce bad bacteria, and help boost good commensal bacteria in their mouth. That way, patients can see optimum results and be extremely healthy. So, there are several biomarkers and different bacteria in our saliva that can indicate that something is going on in the rest of the body. The first thing that we test for in my practice is an enzyme called MMP8. This enzyme is actually responsible for breaking collagen down all throughout the body. So patients will have high MMP8 levels if they have gum issues, if they have issues in their gut or digestive system, or if they're experiencing pain and achiness in their joints. We also do a salivary microbiome test, and this test will tell us what bacteria are present, and it also relates it to systemic conditions. For example, we often will see high levels of 2 different types of bacteria. One is called Fusobacterium nucleatum, and the other one is Porphyromonas gingivalis. And those bacteria are implicated in several different systemic diseases, ranging from heart disease, diabetes, Alzheimer's and dementia, and even fertility complications. So when people come into my practice, the first thing that we want to do is take saliva testing. Just like when you go to your physician and you do your yearly physical, and your doctor will draw blood work and take vital signs, I need the same kind of information when people come to my practice. And so we will do a saliva test. And then while we're waiting on the results of the saliva test, we will go ahead and do our clinical exam. So we will match what we see in the mouth, clinical findings, with the patient's symptoms and their saliva testing. That way we can come up with a personalized, precise treatment plan to help our patients get healthy. We see improvements in almost all of our patients that come in that have kind of vague chronic symptoms that they're told that otherwise they're healthy from other healthcare providers and past dentists. Some really big improvements that we have seen in our office using kind of holistic dental approach would be patients that have high blood pressure, patients that have prediabetes, metabolic syndrome, or even full-blown diabetes. We see a ton of improvement, of course, with patients with gut issues. The mouth is the start to the gut. So you cannot have a healthy gut unless you have a healthy mouth. And then my favorite thing to do is to help patients who are having difficulty with fertility and conception, helping them clean up their mouth. That way they increase their chances of being able to have a baby. So at our office, we see patients that have dental insurance and that do not have insurance. And even though someone has dental insurance, chances are the insurance is not going to cover salivary microbiome testing because this is really new to dentistry. And so in our office, we offer many different ways to make this affordable for patients. For one, we do have in-office membership plans that patients can join. That way they can get 1 free microbiome test a year, plus the rest of the services are heavily discounted. And then we also do no interest financing and payment plans for our patients. Our goal is to make holistic biological dental care affordable for everyone. That way everyone has access to the best care possible. So there's 2 different ways that you can schedule an appointment with me. The first is by going to my website, www.collectivehealthsociety.com. You can actually book an appointment directly from the website, or you can give me a call. My phone number is 303-223-2343.